Good afternoon. I'm really honored to be here. I've enjoyed my trip to Spain already, and I thank the association very much for the invitation. Let everyone get hooked up here. So I like to do interactive presentations. It's always a bit of a challenge when the language is different, but I'm going to do a little bit. So I have a first question for you. How many of you would like to raise your profits and make more revenues in your practices? Raise your hands. Just about everyone. Janine Taft and I are here this afternoon to give you some ideas how to do that. Okay? We're going to talk about preventive care, and we're going to talk about wellness plans. I have some good news and some bad news. Who would like the good news first? Who would like the bad news first? Okay. The bad news wins. The bad news is you're here to learn about wellness plans. But the bad news is that wellness plans alone will not give you more profits and revenues in your hospital. That's the bad news. Ready for the good news? Good news is really easy. The good news is if you focus on your clients and focus on preventive care and use wellness plans as a way to deliver preventive care, you will see dramatically increased revenues and increased profits in your hospitals. So I want to talk about Banfield. What I'm going to say today is not an academic exercise. What I'm going to tell you today is how and why Banfield in the United States has become the largest practice in the world and probably the most successful veterinary practice in the world. And you can do the same things in your own practice. This is not rocket science. It's a formula for growth. And if you listen to what Janine and I have to say today, I can almost guarantee you, if you can change your mindset, if you can develop a preventive care mindset and focus your practice on prevention, not just treating disease, you can achieve double-digit revenues and double-digit profits, just like Banfield has for the last several years. Banfield has 855 hospitals scattered throughout the United States. Almost all of them are profitable. Almost all of them have double-digit revenue increases every year. And almost all of them have double-digit profit increases every year. Banfield is in 43 states. 14,000 people in the United States who now work for Banfield. It's one of the biggest, it is probably the biggest employer in veterinary medicine. There are almost 3,000 veterinarians who work for Banfield. That's my job. I'm responsible for the quality of the medicine and the stewardship of those 3,000 veterinarians. We hired almost 5,000 people just last year. Workforce is largely female. We saw 8 million client visits last year. And this is the amazing part. Almost 2 million of our clients are on wellness plans. And you know how that happened? That happens because our veterinarians are developing the mindset around preventive care. You can't just sell wellness plans. You have to make prevention a part of your practice every dog, every cat, every day. That's a mindset change. Anyone can show you how to do wellness plans. But in order to be successful, you have to think like your clients. In order to be successful, you have to think like your clients. How many own a dog or a cat? Just about everyone. And if I asked you, what is your goal for your dog and your cat? I bet almost everyone in the room would say, I want my dog or my cat to live a long, happy, healthy life. There's the conundrum. Y'all went to vet school to learn how to treat disease, how to do surgery, how to do medicine. But your clients want something different. And that's why clients are not coming as frequently to the veterinarian anymore. Your clients want something different. What your clients want is a long, happy life with their pets. They want preventive care. So Banfield has been successful by focusing on preventive care, by focusing on clients, and taking good care of the 14,000 people who work for Banfield. And Banfield is very different than most practices in the United States. I've heard a lot about the problems that you have here in Spain. The increased tax, the fact that medications can no longer be dispensed from your hospitals. But I'll tell you, the practice of veterinary medicine in the United States is in trouble, just like it is here. A third of the practices in the United States make no profit at all. Let me say that again. A third of the practices in the United States do not make any money at all. A third make around 5%. That's profit per year. And a third of the practices are successful. Veterinary medicine worldwide has a problem. And the problem is this. Clients, dog and cat owners, are not coming to the veterinarian as much. They're not getting what they need from their veterinarian. They want their pets to be healthy. What do they get from their veterinarian? They get transactions. You come in, I do surgery, I treat your ear infection, and then I say, see ya. Means I'll see you again next time your pet gets sick. Of course they're not coming to the veterinarian. The veterinarians are not telling them why they need preventive care. So the facts are that in the last 10 years, in the United States, a very rich country with lots of dogs and cats, the number of dog and cat owners who are going to the veterinarian has decreased every single year for the last 10 years. Decreased every single year. And what's happened because of that? Veterinarians have raised their prices. In addition to that, just like with you, the drugs are now being sold by retailers. It's not mandated by law in the United States, but the Walmarts and the Costcos, the big box retailers are all selling heartworm and flea and tick medication. So the typical revenue that a veterinarian could count on has been going like this. Clients aren't coming in as much. They're not selling as much. And so what have they done? They've raised their prices. That's easy, right? It's easy to raise your prices. But what veterinarians are not very good at, they're not very good at explaining the value of the increased price. So what that's resulted in is clients going elsewhere for care. It's resulted in clients going elsewhere for care. Low-cost spay and neuter clinics. The internet. Or they don't get care at all. They wait. They wait and they wait and they wait. And this is a vicious cycle. It just goes around and around. The more the prices go up, the less come in, and every year it's getting worse. And it's not just because of the recession. That's a really important point. This started 10 years ago in the United States. You can't just blame it on today's finances. And even now, as the recession recedes in the United States, things are not getting better. Clients, this past year, we did another survey of looking at veterinary clients in the U.S. And guess what? Dog and cat visits are still going down. We don't do a good job communicating the value of what we do. We do not do a good job of communicating value. When you take your car in to get the brakes fixed, you expect the mechanic to explain the value of the money you're spending. Veterinarians, as a rule, have not done this well. So for a long time, the veterinarian was the most trusted professional. But that's changing. As prices have gone up, and we're not explaining the reasons why, people are frustrated. They're frustrated with their veterinarian. And what they want more than anything else is they want their dog and cat to be healthy. And what do we say at the end of the visit? We say, see ya. Or how many of you have heard, I know none of you would ever say this, how many of you have ever heard a veterinarian say, I hope I don't have to see you again for 2 years? Ever hear that? Yeah, I bet you have. There's a great way to build a practice, right? Visits are down. They're down and they're down and they're down. Every study in the United States has shown a decrease in visits in the last 10 years. It's not the recession. You can't blame it on the recession. It's ourselves. And I've said it 4 times already, and I'm going to say it probably until you get tired of hearing it today. We have to change our mindset. We have to become just like our clients. We have to become as interested in preventive care as they are. I'm going to say it again. We have to become as interested in preventive care as our clients are. Wellness plans are a vehicle. It starts here, though. It starts with our mindset. In the United States, this is the new veterinary hospital. This is where people get their veterinary care. The newest veterinary hospital. Costco. People go to get their heartworm medication, their flea and tick medication. Who educates them? Who educates them? Right? I don't know how many of you have ever been to the States and been to a Costco. Did you ever, or I'm sure they have big box retailers here. Have you ever seen anybody at a big box retailer educate a client about how to put flea medication on a cat? Or how to pick the right flea medication for the dog versus the cat? Or how to take care of the environment? Of course you haven't. Most of these retail stores, you don't see anybody, let alone anybody who's going to do any education. So there are 3 big trends that are happening. 3 things. One is the revenue and profits of veterinary hospitals is decreasing. And it's decreasing for the reasons that I've already mentioned. The other thing that's happening that may be even more important on the long term is that our role is being diminished. The role of the veterinarian is being diminished. Clients are getting their information elsewhere. Clients are getting their information elsewhere. That is a disaster for us. We have got to bring these clients back into our hospitals. And we can do that through preventive care visits. So the revenues are decreasing, our influence is decreasing, and maybe the worst of all, our pets are getting sicker. Pets in the United States are getting sicker. Can you believe that? How many of you believe that? Pets in the United States are getting sicker. Just raise your hands if you believe that. A couple of you. It's absolutely true. And they're getting sicker because people are not going to the veterinarian. So as I've said, Banfield's the biggest practice in the world. We saw 8 million dogs and cats last year. Every year, we do a survey of our own pets in Banfield hospitals, which are pretty good preventive care hospitals, and we want to see how our dogs and cats are doing. We started out in 2011. And we looked at what should be easily preventable diseases. And in the blue are cats, and in the beige is dogs. And the numbers are the increases in the previous 5 years. So for dental disease, in Banfield hospitals, these are dogs and cats with a diagnosis of dental disease, a 12% increase in dogs with dental disease, a 10% increase in cats with dental disease. I mean, the internal parasite numbers are absolutely amazing, right? How many drugs are there for internal parasites in dogs and cats? A 30% increase in the diagnosis of intestinal parasites in dogs, a 13% increase in cats. The next one may be the most amazing of all. 32% increase in the diagnosis of diabetes in dogs, a 16% increase in the diagnosis of diabetes in cats. And then you can see flea and ticks. The next year, 2012, we looked at chronic disease. We looked at arthritis, thyroid disease, kidney disease, heart disease. The one I want you to focus on is the one that we can do something easily about, relatively easily about, and that's through nutrition, and that's the prevalence of obesity. Look at those numbers, the increase in obesity in dogs and cats in the last 5 years. 37% increase in obesity in dogs. 90% increase in obesity diagnosis in cats. So why do we see diabetes in dogs? We used to think that diabetes in dogs was just like type 1 diabetes in humans, that it wasn't affected by body weight. That's absolutely wrong. Diabetes in dogs, just like in humans and cats, occurs with obesity. It is a preventable disease, and these numbers prove it. And if clients don't come to the veterinarian, it's not that surprising that their dogs and cats are getting diabetes. 2 years ago, we did geographic surveys in the United States. And we asked the simple question, in what parts of the United States do dogs and cats live the longest, and why? And it was no surprise that the shortest lived dogs and cats were in the southern part of the United States, where preventive care is the worst. Heartworm prevention, the worst. Flea and tick prevention, the worst. Spay and neuter, the worst. Again, proof that preventive care can impact the lives of dogs and cats. In 2014, we looked at infectious disease in dogs and cats. And again, in almost every case, the prevalence of dog and cat infectious disease is on the rise. So look what's happening. Decreased revenues, decreased impact, and sicker pets. It's relatively easy to make a case, I think, for preventive care. I'm briefly going to just talk a little about education in the United States, because education and practice are all connected, right? We're in a system. If things go wrong in education, they'll go wrong in practice. If things go wrong in practice, they can go wrong with vet education. We're very much connected in a system. So in the U.S., the total number of applicants to veterinary school is staying roughly the same. It's been the same for years. Yet the number of applicants, the number of spots per applicant is decreasing. Males are no longer applying to veterinary school. Student debt is out of control. And there's tremendous pressure on the schools to stop training so many veterinarians. And I say to you, the problem is not too many vets. The problem is that we're still training vets the way we did in 1955. The problem is we're training the vets the same way we did in 1955. We're not teaching them how to communicate. We're not teaching them how to build relationships with human beings. And maybe most importantly today, we're not teaching them anything about small animal preventive disease. They get out of school excited about Cushing's disease, diabetes, Addison's disease, and they couldn't care less about prevention. They know nothing about nutrition, behavior, risk-based care, dentistry, all the things that are so critical to a preventive care practice. So the applicant pool is staying the same, the number of applicants per slot is decreasing, and the debt is huge. And I know you probably don't have that problem here in Spain, but again, it's in the United States, it is such an imperative for the schools to change what they're doing. They need to produce graduates. The schools need to produce graduates who are practice ready, who can communicate well to clients, who can build strong relationships with clients, and give clients what they want more than anything else, which are healthy pets at cost-effective care. So I hope in the last 35 minutes, I've made the case as to why prevention is important. And I'll summarize that now. Preventing disease is more cost-effective than treating disease. How many of you believe that? You believe that prevention? Just look at diabetes. How much easier is it to prevent diabetes through good nutrition and preventing obesity than it is to treat a diabetic dog? If you can get the client to even treat the diabetic dog. It's what clients want. They want cost-effective care. If you can bring your clients back, the ones who are not coming in anymore, for once a year or twice a year preventive care visits, you can bring back some of those revenues. And you can bring them back, but you have to educate them, as I'll say in just a minute. You can reduce disease in dogs. You can reduce zoonotic disease in dogs and cats. But probably the why for preventive care, the big why more than anything else, it's what you want for your own dogs and cats, and it's what your clients want for their dogs and cats. And you have to get mad about it a little bit. You have to really look at the way you're practicing today and say, is this the way I want to practice? Is all I want to do take care of sick dogs and cats? It's a choice. The speaker before lunch talked about choices. You have a choice. You can practice the way you've practiced for years. You can practice the way you learned to practice in veterinary school, or you can change. It's your choice. I can guarantee you, from what I've seen at Banfield, if you're willing to make that change, every dog, every cat, every single time, and think about prevention, you will change your practices. You're going to have to bring everybody along, all the doctors who work for you, all the technicians who work for you, all the front desk people. They all have to buy into this. But if you buy into this, you can change your practice. And you can change it quickly. Pet owners do not understand why it's important to go to a vet. I'm going to say that again. That's really, again, it's a simple statement, but it's really profound. If you ask pet owners, do I need to bring my normal dog or cat to a vet? What's the answer? No. The answer is resoundingly no. And why don't they know that it's important to bring their normal dog and cat to a vet? The answer is simple. Nobody's told them. Nobody has explained to them why it's important to come in once a year or once every other year. Nobody's told them the importance of finding a mast cell tumor when it's small. Nobody told them that if you find a mast cell tumor when it's small, maybe it can be cured. No one told them that if you work on giving a proper diet to a dog and a cat, maybe you can prevent obesity. Nobody told them that if you start pain relievers early before a dog becomes lame with arthritis, the quality and length of life may be increased. I'll ask you another question. I already know the answer to this. How many of you went to veterinary school to become an educator? How many of you went to veterinary school to become an educator? What do you think you do every day? What do you think you do every day? What do you think the most important part of our job is every day? Yes, we treat disease, ear infections, skin disease, diabetes, all the fun stuff. But what I tell our 3,000 doctors is this. Banfield will know that it is the best preventive care practice in the world when our clients are the best educated about prevention. There's studies in human medicine which have proven that. The people who take the best care of themselves are the best educated. Does it take a few extra minutes to explain to someone why they need to come back in 6 months? Why it's important to get the teeth cleaned? Why it's important to have a physical exam done every 6 months? A year in the life of a dog or a cat is a long time, right? It's a long time not to see a vet. Just think about, most of you I'm sure have children. Could you imagine not taking your children, or you've had children or grandchildren, not taking your children to a pediatrician for 7 years? 6 years? Why do you take young kids to the pediatrician so frequently? Largely because of prevention. Just think about that. Think about how we have to change as a profession. So we are a see ya profession. We are, thanks for coming in, Mrs. Jones. I'll see you next time. And what it says at the end of that, ... You know what it says? See you next time your pet gets sick. That's sad. That is really sad. That's why people are not coming to the veterinarian, because we're not telling them. We're saying see ya. And we have to get away from that. So should we do anything different? You bet we have to. We have to think differently. Every client, every dog, every single time, we have to talk to clients about what's next. And I talk to our veterinarians about a what's next examination. So I'll say that again. You can write that down. A what's next examination. And that means every time a client is there, before they leave, even if it's only 5 minutes, someone on the team has a discussion about what's next. Whether it be dental disease, a small tumor, the potential of a tumor, weight control, there's always something that's what's next. So I want you to think back to veterinary school, okay? Now think back to veterinary school. And this is sort of what you need to think about for what's next. And you know it for your own pets, but how many of you explain this to your clients? How many of you explain age, breed, and sex predispositions to your clients? How many of you have seen Doberman pinchers with cardiomyopathy, cardiac disease in Dobermans? How many of you have seen splenic tumors in golden retrievers? Raise your hand if you've seen, who's seen a splenic tumor in a golden retriever? Okay? How many of you have seen cardiac, raise your hand if you've seen cardiac disease in Doberman pinchers? How many of you have seen any kind of skin tumor in a boxer? How many of you have seen gastric torsion in a large breed dog? Every one of the conditions I've mentioned is potentially preventable. Every single one of them with early diagnosis. But how many times, and you don't have to raise your hand, how many of you spend the time with each client explaining just even briefly the things that their dog or cat is predisposed to by breed, age, or sex? Do we take the time to talk about mammary tumors in unspayed females? Do we talk about the consequences of that disease? This is the what's next discussion. This is why clients do not understand why they need to go to the veterinarian, because we don't explain current and future risk. And you know what else we do? At least I did when I was practicing. Can't say all of you did. We talk too fast. We go blah, 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 blah. We all talk too fast, and we don't stop and ask the client, do you understand? I tell every one of our associates, every time I'm in our hospitals, there is one thing they should always do. And here's my practice tip of the day. This will make the meeting worthwhile. Ready? My big practice tip of the day for you. Ask every client before they leave, did you understand? 3 times. Every client, every time, someone on the team asks them, did you understand what the doctor said? Did you understand what I said? And say it like you mean it, not with your hand on the door. Do you understand why it's important that you come back in 6 months for that dental cleaning? Do you understand why it's important that you come back in 6 months so we can check on the body weight? Do you understand why it's important that you come back in 6 months with a Cocker Spaniel that's predisposed to glaucoma? Always check for understanding. This is what our clients want. This is what they're desperate for. They want their pets healthy, and they want to do it in a cost-effective way. And this is really the story of wellness plans. And Janine's going to come up in just a minute. And we're going to talk more about the specifics of wellness plans. But wellness plans allow you to do preventive care. They allow you to do it in a cost-effective and an affordable way. When we survey our clients, and Janine just shared some information again, it doesn't matter how wealthy your clients are or how poor they are, everyone wants value for the dollar. And wellness plans, if done well, especially early in life, provide great value for the dollar. And so now I'm going to ask my partner in crime here, Janine Taft, to come up, and she's going to talk more specifically about wellness plans, how to do wellness plans, and how, and again, it's more than just wellness plans, but how do you connect the client 365 days a year with the practice? Not just once a year, Not just the see you mentality, but 365 days a year. And maybe before we get to questions, I just want to summarize just a few things for you to keep in mind here, and to give you some summary thoughts, and hopefully they'll stimulate some questions. So the first thing, and again, both Janine and I have emphasized this for the last hour and a half, is if you want to change your practice, and it's up to you, it's your choice. You have to make this choice. You can become a preventive care advocate, but it's a choice. You can go on and just mainly practice reactive medicine and wait for people to come in when their pets are sick, or you can become a preventive care advocate. Preventive care, as Janine already said, can actually be a bit boring. How many normal dogs do you see every day? How many normal physical exams? But remember what it's like to have your own pet when you brought your pet to a veterinarian, or maybe more relevant, when you brought a child or a grandchild to a physician, and they complimented you on the preventive care that you've provided. Think how good you felt when your physician said, boy, your child is doing great. Weight is good and everything is just fine. You're doing a great job. How many of you have complimented your clients on the great job that they're doing with preventive care? How many of you compliment your clients and remind them that, boy, great job on cleaning those teeth. You're really helping to prevent lots of disease. So that's part of becoming a preventive care advocate. It's getting excited about preventive care. It's getting as excited as your clients are about preventive care. Then I want to emphasize, Janine was really good at this, I want to emphasize again the importance of collecting stories. You have to educate your clients about prevention, and the best way to do that is with stories. So I'm going to give you, before we do questions, I'm just going to give you a couple more stories. Janine gave some great personal experiences. Just a couple more quick stories. One's about heartworm disease in the U.S. There was a client who came into one of our Banfield hospitals, and they had been coming in every 3 years and had been taking home heartworm prevention. And now it was the third year that the client came into the hospital, and the poor dog actually had heartworm disease. And the veterinarian was perplexed. He asked himself, what went wrong? And then he asked the client, I've talked to you about heartworm prevention every 3 years. I've given you the medication. What went wrong? How did we end up with heartworm in your dog? And you know what that client said? He said, Doc, you just didn't tell me hard enough. Doc, you didn't tell me hard enough. How many times do we tell our clients hard enough about flea protection, about internal parasite control, about infectious disease control? Or do we just go through our usual spiel and try to get the words out as fast as we can so we can get on to the next case? Have we told them hard enough? Have we told them hard enough that they will actually do what we've recommended? And then another story is maybe a brighter story, just an example of what preventive dentistry can do. One of our hospitals in New Jersey saw a 3-year-old dog, young dog, happy and healthy, no problems. Owner hadn't seen anything. Dog was on a Banfield wellness plan. Came in to have the teeth cleaned. And while the technician was cleaning the teeth, she noticed a very small tumor in the back of the dog's mouth. The owner agreed to have it biopsied. It was a squamous cell carcinoma. It was less than the size of a dime. To make the long story short, surgery was done, the tumor was removed, and the dog is now living a happy, healthy life. Most of you have seen, how many of you have seen oral tumors? How many of you have seen tumors in the mouth of dogs or cats? Everybody just about, right? How many of you have ever seen one that was the size of a dime? Most don't. Most of the time, you only see the tumors when they're very large and very hard to treat. That's the importance of preventive care. Those are the kind of stories you want to collect. Those are the kind of stories you want to talk to your teams about. And then you want to get scripts. You want to have your teams have some consistency in how they talk to clients. You need to explain each and every time to new clients why vaccination is important. Again, after you've done it 5 times during the day, it's boring. I'm tired. I don't want to do this again. But for the client, it's the first time. And so you want to talk to your teams about the scripts that they use, the words that they use, so that they're consistent. It is about a choice. And we'll end this in just a minute. It's a choice that you can make. I can guarantee you from what I've seen at Banfield in the 5.5 years that I've led the medical practice at Banfield, that it will make a huge difference in your practice. But you have to change the way you practice. You have to slow down. You have to talk more clearly. And you have to make the client the center. You truly have to have a client-centric practice. And then if you add wellness plans to a client-centric practice where you focus on prevention, I can guarantee you, I can look at each one of you in the eye, and I will bet a year from now, a year and a half from now, 2 years from now, you will be amazed at the amount of new revenue you have in your practice and how much new profits you have. So I want to thank you on behalf of Janine and I again for the invitation to come to Spain, and we'd like to take lots of questions, either the practical or, as Janine said, the impractical, which is my role. Thank you so much.
Bueno, vamos a hacer el turno de preguntas, ¿vale? Han acabado bien de tiempo, con lo cual perfecto, porque podremos aprovechar para hacer más preguntas. Thank you very much, Jeffrey, Janine. Bueno, adelante, levantáis la mano si os pasamos el micro. Por aquí, después.
Sí, muchas gracias por todo lo que nos llevamos sobre prevención. Yo quiero hacer una pregunta concreta. ¿Tienen datos de clientes, de número de planes, de programas y económicos cuando se podía cobrar al contado y cuando han hecho un fraccionamiento de pago mensual?
So just to ensure I've got the questions, the difference with client acceptance when they had to pay cash versus the client acceptance when we introduced the monthly plans. Is that right? Yes. So we have a field in our system that is, we can mark client declines. So it means the client declines the service, whether that's from they don't believe in the service or they may not be able to afford it. I can't distinguish which way. But non-wellness plan clients, the client declined is probably 42% of the time they decline the service. For wellness plan clients, they only decline 10% of the time. So it's a pretty good indicator of the willingness to accept the recommendation. For the things that are covered inside the plan, 80% of those services are delivered. So vaccinations and dental care and parasite control, those things are delivered through the plan, so they pay for them. In terms of clients stopping payment on their wellness plan, that does happen. So we'll have some clients who come in who receive services and then try to cancel their plan or not pay their bill. We don't have that. It's probably 10% of the time where that happens, and we are able to collect that after. So you want to have a good banking partner who can help you with that piece, but it is something to look out for. It's why it's important to understand what services have been delivered and what money has been paid. But it's a small percent. The majority of the people pay their bill. Does that answer the question? No?
No, yo decía la aceptación de programas preventivos cuando se hace un pago al contado o cuando ese mismo plan se hace un fraccionamiento de pago.
Yes. So preventive care treatment. So the preventive care recommendations with the wellness plan, very significant, 80%. Non-wellness plan customers, so those that are paying cash or coming in or prior to the wellness plan, only about 30%. Is that right?
Do you have monthly, do you all have them all on monthly basis?
We have both, you can pay once, so yearly or monthly.
Buenas tardes. En primer lugar, felicidades por la presentación, gracias. Tengo una doble pregunta. La primera sería, ¿quién debe comunicar el plan a los clientes? ¿Si tiene que ser todo el equipo o tiene que haber personas especializadas en la comunicación? Y la segunda pregunta sería, ¿cuál es el mejor momento de la venta? ¿Si tiene que ser en la consulta o tiene que ser en momentos de en tiempos de espera, en sala de espera? ¿Cuál es el mejor momento para vender los planes dentro de la clínica?
So I'll start with that one. So who should communicate the plan? And I think we at Banfield have very strong feelings about that. It should be everyone. Everyone. But it's communicated differently. When a client walks up to the front desk at Banfield, if they're not on a wellness plan, we expect the receptionist to at least introduce the idea of a wellness plan. Hi, it's your first time at Banfield. Really glad you're here. I know that keeping your pet healthy is really important to you, and we have wellness plans. Now the doctor and the technician are going to explain more about it, but I'm going to give you a handout here. Just keep this with you. You have a few minutes. Take a look at this before you see the doctor while you're waiting. Doctor comes in the room with the technician, and then reinforces what the receptionist said. Starts to talk about the pet, maybe what the current problem is, but then starts to talk about prevention. And usually, the best question to ask is, what's your goal for your pet, especially if it's a new pet? My goal is, I want my pet to live a long, happy, healthy life. Well, I'm so glad you came to Banfield, because we're a practice that does prevention, and that's our goal. So our goals are aligned, and the best way for your pet to live a long, happy, healthy life is to be on a wellness plan. And that's because it allows you to come in frequently without having additional cost. You can come in, you'll come in at least twice a year, but you may come in more than that. And it gives us a chance to do a physical examination and have a discussion with you on every visit about what we're worried about and what we're thinking about. Does that make sense to you? Did you understand that? And that's a little bit how that discussion goes.
And the point I would add is someone who knows communication well can design scripting for training your teams. So you do want to have a consistent message. So getting that scripting in place and maybe a handout or flyer for the client so you ensure that the message is communicated correctly. But Jeff is right, it needs to be every point of contact within the hospital.
And at the end of the day, I really believe that if your team members don't believe in the wellness plan, if they think it's too expensive, if they think it really doesn't provide value, it won't work in your hospitals. So before you can even think about who's going to talk about the wellness plan, you have to have team meetings to start thinking about the wellness plan itself. And that's where the stories become important. The stories like Janine told, where her cat lived a lot longer because it was on a wellness plan. You can't force people to believe, but hopefully you can capture their minds and their hearts just the way we're trying to capture your minds and hearts today.
Buenas tardes. Gracias por las presentaciones, yo creo que muy interesantes y prácticas. Y bueno, Jordi, la verdad es que me ha chafado la pregunta en parte. Yo quería preguntar sobre el tema del plan de comunicación. Es importante tener unos buenos planes de salud, pero igualmente importante es es comunicarlos a los clientes. Un poco por la respuesta a la pregunta anterior, he entendido que básicamente es cuando el cliente va a vuestras clínicas, cuando informáis de los planes de salud. ¿Tenéis algún otro plan más amplio, redes, lo que no es físicamente, etcétera? Y una segunda pregunta está relacionada con la valoración de los planes por parte de los clientes. ¿Hacéis algún tipo de encuesta de valoración clientes que tienen planes de salud versus los que no los tienen? Y los que no los tienen, ¿sabéis por qué no los tienen? ¿Es porque ellos no ven el valor o es porque el equipo no los transmite adecuadamente? ¿Cómo podemos mejorar ahí?
Three questions. Okay. Okay. So first, yes, we have a very robust communication strategy outside of the hospital. While we expect and hope that our teams do a spectacular job, we also know that doesn't always happen. Banfield has a very large web presence. We utilize social media. Social media is wonderful. It is hard for Banfield, right, because we have 850 hospitals, so client experience is this. Some days we're not so happy clients, so you have to be prepared for when you open up to those social media channels, being able to respond when you have a client complaint. So don't turn it on without being prepared to respond, because that can be not a good thing. But we have quarterly campaigns that go to our clients that reinforce, educate around dental care, parasites, nutrition, and wellness plans. So we have a very robust system. We send vaccine reminders, and for wellness plan customers, we send twice-a-year reminders that they're due for their twice-a-year visit. So yes, lots of communication and reinforcement of what's said in the hospital. That was the first one. The second question, do we survey our wellness plan clients to understand their happiness and satisfaction? So yes, we have a client experience survey that we do that surveys all of our customers on the experience in the hospital. So did you have a good visit? Were you happy? There's a lot of questions. Takes about 7 minutes to answer it. And we measure satisfaction of wellness plan customers and non-wellness plan customers. We have generally higher satisfaction with our wellness plan customers, not surprising. And yes, we do survey why they're on the plan versus why we're not. So wellness plan customers tend to be on the plan because their veterinarian recommended it. So those that are not, there are two main reasons at Banfield. One of them is that we are unique in the hours of operation, so we're open longer hours than a lot of other veterinarians. So we're open Saturdays and Sundays, and we're open till 7, 8 o'clock. So for many clients, Banfield is their second veterinarian. So they have another veterinarian, and they come to Banfield when they can't get into their vet. So those people tend not to sign up on the wellness plan, makes sense. The second is they didn't understand. Nobody communicated the value. So it is it's at the veterinarian. They didn't recommend it, the team didn't recommend it. Yeah, and then there are a few clients that simply can't afford that, right? They're coming in just for their rabies vaccine and maybe a few additional services, and even spreading it out over a monthly payment, they just can't afford it. So there is a portion that can't afford as well.
Hola, buenas tardes. Dos preguntas. Una era, ¿por qué sugiere delimitar o acotar el número de visitas que incluye el plan en 3 o 4 solo al año? Y el otro, ¿por qué es un 10% el descuento frente al precio habitual?
Yeah, so our plans today are unlimited office visits. My recommendation to start with 1 or 2 or 3 to 4 is that if you are manually tracking how often your clients are coming in, you could have problems profitability-wise if you're not tracking those services and really understanding how many times are your clients coming in, and then pricing it might become unaffordable. If a client is visiting you only once or twice a year now, if you tried to price it and say, I'm going to include 4 visits in that plan, and you spread that over 12 months, your monthly cost may be too expensive. You may not get people to sign up. So if most of your clients are coming in once or twice a year, you want to start there. For us, we can track the services and the profitability across 1.7 million wellness plans. We have some clients where we lose money. They probably lose money on me because I come in a lot. But there's other clients who are not coming in as frequently, so the value of multi-unit math, we can afford it. But for a smaller practice, wouldn't recommend going unlimited to start with. The discount percent is just a little bit the same. Ours are discounted right now. The core services like vaccinations are discounted at about 40%, but things like a dental is only discounted at 10%. And part of that is the labor. So with vaccines, the majority of that is in the cost of the actual vaccine for us. The labor is pretty easy. A dental requires additional labor and anesthesia, so we don't want to discount it as heavily. So it really is percent of labor. You want to discount less if it's high labor item.
And I just wanted to add one more thing. When I went to veterinary school and when I taught for years at the University of Minnesota, I always told our students you should never give away your physical exam. You should always charge for the physical exam. When I went to Banfield, I realized what a problem that was. How many people don't get care because of the charge for the physical examination? How many people think about coming in, but because in the United States the average examination is probably $75 now, how many people truly don't come in because of that? And so once you either discount the physical exam or actually just give it away and make it easy for people to come in, remove that barrier to care. Janine showed you the figures. It is amazing how much more our wellness plan clients come in than our non-wellness plan clients. That really is the key takeaway, and that's not necessarily intuitive. You may not believe that to be true, but it is amazing just that one barrier to care the exam charge can be.
Buenas tardes, muchas gracias por sus presentaciones que han sido muy claras y concisas. Mi pregunta va relacionada con los seguros de asistencia veterinaria. Querría saber cómo está la situación en Estados Unidos, si Banfield trabaja con seguros o con alguna compañía o con todas, y si el seguro de asistencia veterinaria complementa o no complementa los planes de bienestar. Gracias.
Yeah. So today, we do not work with insurance companies. The situation in the U.S. is very small percentage of pet owners have insurance, so it's less than 2%, so a very small portion. We are exploring insurance and partnerships with an insurance company to complement our wellness plan as the insurance begins to gain popularity in the United States. But right now we don't offer insurance. We do accept insurance, so if people have insurance, we will process the claims and give them reports to send to the insurance company so people can have insurance and come to Banfield, but we don't have a partnership with anyone at this time. But it's such a small portion of the US population today. In Spain, is it much greater? Yeah, much greater. Yeah.
I want to emphasize what Janine said earlier in her lecture. One of the biggest problems with wellness plans is a confusion with insurance. And so it's really important that your teams know how to talk to clients and explain the difference between a wellness plan and insurance, and that you give your clients written material or you have material on your website that differentiates insurance from wellness. Because that makes people very upset when they think they're buying, when they bought a wellness plan, but they think they're buying insurance. So that's not a small issue. It's one of the reasons why we haven't done insurance till now. We wanted to get wellness right. And we figured once we get wellness right, then we may be able to do insurance and wellness. But right now it's hard enough just to explain the difference. So we stayed away from insurance ourselves.
Hola, buenas tardes. Quería que me contaran si cómo manejan los incentivos con los equipos por la venta de los planes de bienestar. Si utilizan los incentivos y cómo los manejan con el equipo auxiliar, sobre todo.
You know, it's funny. When I started at Banfield, we incented our team members. So our paraprofessionals, basically, we had a set fee. It was $15 per plan. And the last 3 people who talked to the client got, $5 each. We've removed it. What we actually found is it was incenting the wrong behavior. So by incenting the team members to sell a wellness plan, they didn't really believe in the wellness plan, and they just sold them to the client. And we had really bad retention. So our clients didn't stay on the plans. They tended not to have, used the services, and they didn't like the plans. So their satisfaction with the plans was very low. So we actually removed the incentive and said, this is your job. Part of your job is we are a preventive care practice, and part of your job is talking to your clients about preventive care and believing in wellness. And if that's not a good fit for you, you may not be a good fit at Banfield. So we have them, it's part of their mindset. And I'll tell you, we were so nervous when we took the incentive away, and we had much better acceptance. It actually improved the enrollment rate versus declining it.
Hola, buenas tardes. 2 preguntitas. Cuando hacen un plan de bienestar, ¿informan de todas las coberturas de cada uno de los servicios con el porcentaje de descuento y el precio del servicio, o solamente el porcentaje de ahorro?
I see her talking, but nothing is happening.
Yes.
¿Informan del costo, cuando hacen un plan de salud, informan del costo del servicio aparte del porcentaje de ahorro de cada una de las coberturas? Y segunda pregunta, ¿estos planes de salud se lo entregan abiertamente por escrito o en la web a los clientes o queda como información interna del hospital?
So they, I think I got it. So we do have all of the prices for the services outside of the wellness plan. So we have a tool for our hospital, so they can see this is how much it would cost if you got the services today. Here's how much it would cost with a wellness plan. So they use that as a tool for communicating with the client. So we do show both the price inside and outside the wellness plan. The wellness plans are for the client. They're not just a tool inside the hospital, so they are sold to the client. So not all of our clients are on plans. Does that answer? Part of? Yeah. Yeah.
Yeah, there was the written part. So, the wellness plan is a contract with the client. So we actually have all the material that describes, what the wellness plan is and what the wellness plan isn't, and we give that to the client. We try to explain that to every new client, and the client actually signs that they've understood what we've talked about. So I think that was your question, is it in writing? So it is in writing to the client.
But before to sign the plan,
Yeah, but what we hope is that our teams will explain the plan, and so before they actually get the plan, that they'll sign it. But certainly some take it home and they read it and they share it with their families, and then we actually have a system where we call them if they haven't gotten the plan in the hospital. We call them a few days later and ask them, do you understand it? Have you read the material? Would you like to sign up now? And that's very effective because, as Janine said when she was talking, it's hard to take all this in when you're in the hospital, and sometimes it's better just to let a few days go by and give people who didn't sign up in the hospital some time to think about it.
And we do follow up with an email to the client or a direct mail that communicates thank you for enrolling in your wellness plan and kind of hits the highlights of what they signed up for in case and if you have any questions, call this number. So they can call and talk to somebody if they go, I didn't realize what I signed up for. And they do have 60 days. If they signed up and they want to cancel, they can cancel the plan without penalty if they didn't really, if somebody sold them the plan and they didn't understand what they were buying. So we do let them go home if they have buyer's remorse but the email is very critical to helping reinforce the education because it doesn't always happen in the hospital.
Buenas tardes, Janine. Buenas tardes, Jeff. Gracias por vuestra charla. Vamos a ver, entiendo que vuestros planes de salud también contemplan que un animal tenga una fractura o que tenga una neumonía y, por tanto, esté contemplado asistirle con un coste anual. ¿Es cierto? Porque aquí, en España al menos, una cosa es el plan de salud y otra cosa es que el animal tiene una incidencia y ha de ser atendido.
No, our health plans only include the preventive care services. They do include diagnostics, so there can be lab work and blood work. But if a pet has a fracture or an injury or an illness, that is not covered by the plan, so that they get a discount. We have wellness plan customers receive a discount on services outside of their wellness plan of about 10%. So they would get a 10% discount on those services, but they would need to pay for those services that day. It's not spread over the full year.
Bueno, ahora aclarado este tema, lo que quiero saber es cómo gestionan los pacientes y clientes que son conflictivos, es decir, un animal que tiene una patología que sabemos que va a venir a la consulta con más frecuencia para ofrecerle un plan de salud, porque este paciente con algún problema va a originar unas visitas múltiples. ¿Cómo gestionan a ese cliente?
So we have multiple levels of our wellness plan. So if it is a pet who has maybe chronic disease, first of all, you can enroll on the basic plan that just covers your vaccines and no dental, and you can easily upgrade your plan to the higher levels. If we have a client that has a pet that is significant issues and needs more blood work, there is the highest level plan, which is called a special care, which tends to be more appropriate for those pets that may need more blood work. So it gets 3 blood works a year instead of 1, an additional diagnostic. But again, it is only covers the preventive care, not the actual sick pet care. But they do receive a bigger discount. So if you're on the special care plan, all services outside of the plan are discounted at 20% versus 10%. So they save money that way.
And I would just say, I mean, there are lots of details about the plan that, it's hard to talk about all the details and probably hard for you to remember. If you go to www.banfield.com, you can view all the different plans, everything that's included in each plan, and get a really good sense as to what those plans look like. www.banfield.com. That's my plug.
That's right. And there is a significant portion of the website that is translated in Spanish for our hospital in Mexico, so much of it you can download in Spanish.
Una pregunta es, ¿qué riesgo hay de que los pacientes, los clientes que contraten los planes sean precisamente los clientes que iban a venir de cualquier cosa porque son los buenos clientes, vamos a decir? Y en cualquier caso iban a venir.
Well, I mean, that's, I think it is our good clients who get the wellness plans. There's no doubt about it. But I think even good veterinary clients stop coming to the veterinarian or don't come to the veterinarian as frequently as they should. So the question is, how often should a good client come to a veterinarian? And I think, again, what we found is, and I'll repeat it again, our wellness plan clients come in much more frequently than our non-wellness plan clients. And I think we have non-wellness plan clients who are good clients as well. But being on that wellness plan, having that package of services, knowing that every 6 months I'm supposed to come in, and I can come in between if I need to, makes a big difference, even for your best clients.
Yeah, and I think what I would say is your best clients are going to spend even more money outside of the wellness plan. So within our wellness plan customers, we have 4 tiers of wellness plan customers. The numbers I showed with 4 visits a year, that's an average. Your best customers, which would be me and probably Jeffrey, we come in 5, 6, 7 times a year, and some of those wellness plan customers just come in the 2 times or even once per year. So there are tiers within there. That's why for me, when you start with a wellness plan, you don't want to discount them too deeply until you understand the economics of them, right? So 10% is probably as deep as you would want to go to begin a wellness plan. But I will tell you, there's 4 tiers within the wellness plan, and those very best wellness plan customers spend an awful lot of money with Banfield, and more than they did prior. So we can track clients that were wellness plan customers and what they did before, and there's a significant increase in spend when they join the wellness plan, even if they were already a good and loyal customer.
And I will just emphasize the number that Janine said again. It's an amazing number. 80% of the revenue of Banfield comes from wellness plan clients, either within the plan or outside the plan. And so we've turned a lot of clients who might not be good clients into good clients, and they're coming in frequently.
And I think the key statistic there is only 40% of that comes from inside the plan. So even if it was discounted, if that's all your best customers were spending, they're still spending now another 60% outside the plan. So it definitely does increase.